Have you ever seen or heard of people who seemed happy? People who were the life of every social gathering. They made those around them happy. Ironically, those very people later got diagnosed with depression. This leaves one wondering, how would such an individual who was full of life suffer from depression? When one hears of depression, we assume that the people who suffer from depression must look and be sad. We assume one cannot seem happy but depressed. However, this is not always the case. Some people who suffer from depression are great at masking up their depression by exhibiting an excited and humorous trait. Some immerse themselves in work to block the overwhelming thoughts or emotions, which can often be misconstrued for hard work. This is what is termed as smiling depression or high-functioning depression. So what is depression? Depression is a mood disorder that is characterized by persistent, intense sadness, loss of interest, and feelings of hopelessness and helplessness. It affects how you feel, think, and behave. This generally affects one's general well-being, how they handle their daily activities, and daily functioning of the person. Depression leaves one feeling lonely, even when surrounded by supportive people. What you need to note is, depression looks different on everyone. It is important to also know that one can slide into depression easily with just one trigger. According to WHO, 264 million people of all ages suffer from depression, with Kenya being ranked 6th in Africa for the number of people living with depression, and it's estimated that over 1.9 million people in Kenya suffer from depression. What we need to understand is the severity of the depression differs in individuals ranging from mild, moderate to severe, with severe depression creating significant dysfunction in one's general life and requires one to seek treatment as soon as possible. Depression is an illness, and if left untreated, it could lead to serious consequences. The symptoms of depression include at least 5 of the following signs, experienced nearly every day over the course of 2 or more weeks. With depression, one becomes persistently sad, anxious, or suffers an empty mood. Loss of interest in activities that they were once interested in and enjoyed. One loses the ability to express themselves emotionally, also called flat affect. One also suffers loss of appetite, which leads to weight loss, and also overeating accompanied with weight gain. Feelings of hopelessness, pessimism, guilt, worthlessness, or emptiness, unusual fatigue, low energy levels, social withdrawal, having changes in sleep patterns like insomnia or lack of sleep or oversleeping, or a series of early morning awakening, unusual restlessness or irritability, trouble concentrating, remembering or making decisions. These could be accompanied by persistent physical problems such as digestive disorders, headaches or chronic pain that do not respond to treatment, and in severe cases, thoughts of death or suicide attempts. Please note that one shouldn't use this video to self-diagnose. If you relate to most of these symptoms I have mentioned, I suggest you visit a psychiatrist, clinical psychologist, or a counseling psychologist for a proper diagnosis. The severity of these symptoms must also be considered, so use this video as a guideline and see a mental health professional for a conclusive diagnosis. We need to remember that most people who are feeling depressed don't experience every symptom. If you see a loved one that might be showing the signs of depression, it is important to seek the counsel of a trained mental health professional for diagnosis and treatment. of importance is to note that depression is not a sign of weakness, and no one should feel guilty for being depressed. If you are diagnosed with depression, reach out. Find the right help to get back to normal functioning, because good thing is depression is treatable.